So this is something that I've been involved with in Arizona for quite some time. And when we get to the end of this presentation, we'll go very quickly talk about a program we have here in Arizona that has been put in place to deal with large-scale or even smaller-scale livestock disease health problems. So what are we talking about on things that start investigations on health problems? Well, diseases that are a higher rate than normal, or lower production. Animals aren't doing what they're supposed to be doing. The threshold can vary quite a bit. A single case can be a landmark. Those of you that are involved in the beef industry probably remember the cow that stole Christmas, when they had a dairy cow in Washington that tested positive for mad cow disease and absolutely crashed the beef market for several weeks, even though that cow came from Canada. Oops. Sorry. Okay. So, oftentimes people have a misperception about disease in a herd. Oftentimes all we focus on is the animal that shows clinical signs of disease and ignore the ones that are infected but aren't showing obvious disease signs. We call this subclinical. And this has to do with kind of the iceberg effect. The animal on top is the tip of the iceberg. And the ones that are underneath the top of the iceberg are the ones that are kind of subclinically affected. Okay, so what sank the Titanic? The top of the iceberg or the bottom of the iceberg?
The bottom.
The bottom. Something to think about when we're talking about health problems, and that is those animals that are not obviously sick, but are incubating or carrying the disease. So some of the errors is that in these iceberg approaches, we only look at the clinically infected animals. We assume that the absence of clinical signs means that they're not sick, or the absence of disease. Another problem is often we assume that the presence of an agent equals that cause of the disease. Oftentimes, that's not the case. So, if we're dealing with a disease outbreak, we're having a problem in a herd or a flock, immediate steps. Try to minimize additional losses. Oftentimes that means moving them to a different pasture, different paddock. Identify the factors that cause the disease health problem, and the 5 W's. What, who, when, where, and why. What is the initial complaint? Is it a fall in productivity? Is it something that has a public health concern or food safety? Make a case definition. This is really a common problem when I talk to producers that are dealing with problems like an outbreak of diarrhea in calves. How do you define a calf that's sick with diarrhea? Is it the type of manure that's producing? Does it have a fever? Is it how dehydrated that calf is? You have to make a kind of a definition as to what is a case. And this is a real common problem, particularly in feedlots, when we deal with respiratory problems in feedlots, because it's very difficult to define what is a case. So, determine the extent of the herd problem. Make sure the problem is real. And that is sometimes hard to get across. I mean, the fact that you're having maybe an outbreak of pink eye in some lambs may be a real problem, and you forgot the fact that 3 or 4 days before it was really, really windy, and a lot of dust got blown in those calves' eyes. And you're not really dealing with an outbreak, you're just dealing with the after effects of a windy day. Identify risk factors, characteristics of the host. Age, sex, breed, when did it get sick, when was the problem reported, risk factors, those things in your management that can contribute to the problem, and you have to have a correlation between those risk factors and making the problem more severe. When I was teaching the livestock disease class, one of the questions I asked in a midterm is, list the 5 causes of abortion in feedlot steers. feedlot steers can't experience abortion because they're steers. No, the students that answer that question fail that question, so you can't do that. There's zero risk factor for abortion in steers. Okay, when? This is an example of a typical epidemic curve, an outbreak of a disease in a population. Onset, number of cases. Any idea what this curve, this is actually a true curve, it's not COVID. This is a curve of the outbreak of foot and mouth disease in the United Kingdom in 2001. And you can see it's a very, very good example of a traditional outbreak of a disease in a population from a point source. The outbreak of foot and mouth disease in the UK took place because of a pig farm feeding uncooked garbage to pigs that came from a smuggled meat at a Mediterranean restaurant in town. What was the result of, anybody know remember what the result of this was in the UK in terms of this outbreak of foot and mouth disease? 4.5 million animals had to be destroyed. It caused a complete shutdown of transportation and movement in many rural areas in England from February until September, and had a devastating impact on many rural areas of the United Kingdom. Some of those areas still have not recovered from the effects of what happened from this foot and mouth disease outbreak. Yes, sir?
So were those producers not compensated in any way for the loss of their animals?
They were compensated, but there was some problems associated with that. One of the problems being that the stop movement order took place. You have a dairy. Stop movement order means they're not going to come and pick milk up from your dairy, and they're not going to haul feed in to feed your dairy cows. Your dairy cows don't have foot and mouth disease, so you're not getting compensated for that loss. That was one of the problems that occurred. The other problem is that, there was a lot of problems. I could talk for an hour and a half on just what happened in the foot and mouth disease outbreak in the UK, but it also resulted in the suicide of about 120 producers and families in the areas because they were just wiped out. I mean, people that had farmed for generations in one spot, and in an afternoon, everything was gone. So this is a good example of an epidemic curve point source. I think we're all experiencing that right now. Where? Okay, this means where on your property is this taking place? Is it occurring just along a certain creek? Is it in a certain pasture? And you want to look at the management groups that are going on at the same time. So sometimes a map is really helpful in terms of doing this, and neighboring herds. Do any of your neighboring animals, herds, have any of the same type of problems? And is there communal grazing or communal contact? Okay. Where and herd visit. This is what we'll talk more about just in a second when we talk about the program we have here in Arizona. And why? You want to look at the sick animals last. Access may be limited. You try to get individual examination, do a necropsy, which is an animal autopsy. It's called a necropsy. You want to look at the environment, laboratory samples, written notes, digital pictures, and use GPS to locate where these things are taking place. History. Good listening and careful questioning. Try to get a chronological presentation. You want to look at off-farm activities. What are they doing off the farm and maybe sources of income? Changes before and after the outbreak, and are any of the owners or families having a concurrent health problem? This was a really good example of this problem took place in Australia with the outbreak of a virus called the Nipah virus, which is transmitted by fruit bats. It affects horses. and killed several horse trainers, jockeys, and veterinarians who were dealing with these affected horses. So it's a good example of occupational hazards. Okay, so individual examination, you want to do it first from a distance, just looking at the animal, getting an assessment of it. Respiratory rate and character, the GI, is the animal been eating? Is it manure normal? Reproductive status. These are all things you want to record on the animal you're looking at. Posture, gait, body weight, body condition, score, size, frame, and hair cord. These are all things you want to record on the individual examination. Direct exam, you want to look at animals that are severely affected, or mildly affected, or non-affected. You want to look at the early cases and how they're progressing. Look at any recent additions to the herd. Did they bring something in? Reproductive status. Are they just getting pregnant? Are they pregnant and have aborted? Are they not getting pregnant? Body condition scores. And this is one of the real problems, oftentimes, is you want to be able to record and monitor individual animal identification. And this has not been the case often in Southwest producers, but more and more people are understanding that it's important to maintain individual animal ID so that you can track and see what's going on. This may be as simple as if you have a pen full of calves and you're experiencing a problem with respiratory problems, just take a chalk or paint and paint a number on the side if they don't have ear tags, so that you know who's who. You know, it's sometimes hard to tell calves apart or lambs apart. So some way of recording some kind of individual identification so you can record how they're doing. Necropsy. This is not something I recommend that you do yourself, but if you feel inclined to try, this is what you need to do. It can be challenging. So you need to take your samples and eventually submit them to a diagnostic lab. There are very, very few diseases that even a trained person can go out and by simply doing a necropsy, look at some tissues and tell you exactly what's going on. So oftentimes samples have to go to a diagnostic lab. We're very fortunate here in Arizona that we do have a very good diagnostic lab at the University of Arizona. But tissues have to be correctly processed. Have a camera or your phone to record anything you see that's abnormal. Okay, common errors that we see on necropsies. This includes necropsies done by trained veterinarians. They are incomplete. They don't do it in a systematic, repetitive manner. So they just go looking for what they think the answer is, and they don't look at everything. Samples are not collected correctly. We do have contamination, things spilling over. Artifacts as a result of freezing or tissue breakdown. Oftentimes when I was an extension veterinarian, I would get a call, and these calls would go something like this. Hi, I got up and I noticed that I have 5 dead steers in a pen. Do you think it's serious? Yeah, I did. When did you notice this? Well, I noticed the dead ones about 4 days ago. Okay. When you get another one, give me a call, because 4 days in the Arizona weather, you're not going to be able to tell anything at all. So we do have a challenge in terms of heat, and that causes tissues to break down very, very quickly, especially animals that have maybe experienced a bloat problem or something along those lines. So you need to get to them very, very quickly. And bias. This is probably the biggest problem, and that is someone assumes they know what's going on, and all they're going to be doing is going to look for the information that confirms what they think the answer is. And oftentimes they're wrong. And you have to look at the environment. This is a little Colorado river, and it's pretty benign looking stream, isn't it? This pasture right here was responsible for the deaths over 200 registered Hereford cows and calves over one weekend. And it's really the genesis of the program we have here in Arizona. I'll talk to you about it in a minute. But it's not a really dangerous looking place, is it? So sample collection has to be done on a systematic basis. You have to look at milk, blood, urine, tissues, feed, water, soil samples. And want to necropsy more than one animal, which physically is challenging if you're out by yourself. You need to have the right kind of equipment, including sample containers. You want to be able to label the bag and containers so you know what you've collected and what animal it came from. Here's an example of this necropsy going on a cow up in Colorado. And I said, you want to make sure that you label correctly. So, for example, this is a lung sample from that lung up there from that calf, and this is ID numbers and what you're going to be doing with it in terms of testing. GI contents, it's really important. We get a lot of information out of GI contents, and this is an example of getting small intestine into a world pack, small intestinal contents into a world pack. So, fresh tissues, you want to separate in separate bags, double bag, label them, whole blood and everything else has to go in the right kind of tube, and you want to do swabs separately. This is what we often get at a diagnostic lab, which is what you do not want to do, okay? The old way of doing field necropsies was to get a bunch of OB gloves. You go out and grab a bunch of different tissues, wrap it up in one OB glove, put it on the dashboard of your truck for a day or two to let it age, or put it in your freezer, for a couple weeks and then send it to the lab. Or you want to make sure, you want to be efficient, so you get all the parts in one bottle. And that just does not work. So this is all stuff that we found out as we put together the alert program in Arizona. This is not what you want to do. So packaging, actually now there's a lot of federal guidelines in terms of packaging. The best thing in doing, if you're sending samples into the diagnostic lab, contact the lab first, because they'll give you very specific guidelines on how to package materials so that you don't have a problem with biohazards. Okay, so here's an example of a flow chart. And it is, in this case, we're talking about an increased number of calf deaths. Okay, this is what you start looking at it. Okay, is what a catastrophic effect of a false negative test.
Yes.
Should have been tricked.
Yeah, potentially a bull that's infected with trick that comes back as being negative. Even worse would be an example of an animal that bites a kid and is tested for rabies, and the test comes back negative for rabies, and in fact the animal had rabies. Bad news for the individuals, I suppose. So, let me just, I'm supposed to start up at 10:30, right, Russ?
You can go longer.
So no test is 100% sensitive or specific, and test results can be influenced by the occurrence of the disease in a population. In other words, the more uncommon a disease is in a population, the more difficult it is to test for it. Isn't what you think, is it? But that's often the case.
So what do you do? Like are you double testing them, or what do you do to minimize the false positives?
Okay, so let's look at, you gave the example of trick, right? And if you look at most requirements on states, if a bull is being tested as a result of exposure, it requires 3 negative tests a week apart. And that's the reason for it.
Well, how do I know that, say I got 10% positive, I got 90% negative. How do I, and then they go to the positives and say they were false positives. So how do I know that my other 90% were actual negative?
Negative, yeah. That's why repeat testing is often required for that disease. It's very difficult. You have to assume you're exactly right. Your numbers are exactly right. If you tested 100 bulls once for trick, you would assume that you're going to have incorrect results about 10 to 15% of the time. Incorrect results being either false positives or false negatives on one test. If you do 3 tests, that likelihood of the false positive or false negative goes down to less than one half of 1%.
So you're 90% that you're not worried about anymore, but there's a hot one in there.
That's what I'm saying. You can't say that just because of that 90%, the results are correct, but 10% are either going to be false positives or false negatives on one test. So, with the PCR test, false positive tests are very, very rare with trick. False negatives can occur because of several different reasons. That's why the 3 test rule is in place.
So basically, they're doing the best they can with the tools they got.
Right. But certainly doing herd surveillance like you're talking about is a really good idea. I mean, that's the best way to keep on top of it is by doing checking those bulls annually before you use them to make sure you don't have them in your herd. Yeah.
How far apart do you test?
The regulations right now say a week apart with no contact, no sexual contact with cows for that 3-week period. Because they could potentially go out and breed a cow that has it and get infected and not show up for the test. You know, so that's why they do it that way. Okay. The other point that goes along with this is toxicity or poisoning. And I'm just going to jump ahead really quickly. In submitting samples, when we talk about toxicity, this is, at the diagnostic lab, this is one of the most common things we would get, is people calling up and saying, my dog's been poisoned, or my sheep have been poisoned, or something has occurred. And one of the things that often happens is people assume that we have, you know, a miracle box that we put the samples in and we come up with an answer right away. And unfortunately, it doesn't work that way. And some of these toxins can be extremely difficult to find. So that's why we go through a very stepwise procedure. And oftentimes it can be a very tedious process. So we have problems with metals, particularly if we're in areas around suburban areas where there used to be, people used to dump garbage, things like lead from batteries, lead paint, that type of thing. So you can get toxicity from those types of things. Feed, particularly if feed is manufactured incorrectly, or if certain types of supplements are being used and they're not being used correctly. One in particular is urea, which is sometimes used as a protein supplement for range animals. Urea has to be fed on a very consistent basis or else you can have real problems with it. And we have problems with salt and water deprivation. It's not so much salt toxicity, is that it's water deprivation. And so what we've seen is range cattle that have been deprived of trace mineral salts for a long period of time, and then somebody goes out and puts loose salt out, and the cattle load up on the salt, and then they can't get access to water, so they get salt toxicity. Another example is polychlorinated biphenyls, which were used as fire retardants, and they had a case in Michigan back in the 70s where half a ton of fire retardant was mixed into livestock feed and ended up causing the destruction of 1.5 million chickens, 30,000 cattle, and 7,000 other animals. And humans in the area, 5 years later, 95% had residues in human tissues. Herbicides, Some of these can be very, very toxic. Insecticides, including organophosphates, and some of these others that have been used and can cause problems in animals. The example here in this picture is a case that occurred in King County, California, where an organophosphate phosphate was inadvertently dumped into a TMR wagon for a dairy. And these dairy cattle ingested this organophosphate, which resulted in the deaths of 200 animals. And they had to destroy these animals, and they had to end up burning them to get rid of the bodies. Rodenticides are a common problem in suburban areas where people are putting things out to poison gophers. And dogs can get into that, or wildlife can get into it, causing some problems. Biotoxins, the one I'll really talk about it really quickly is botulism, especially if you have horses, because horses are so exquisitely sensitive to botulism. And we do see a lot of botulism in horses in Arizona. It's not an uncommon problem because horses are so sensitive to it. The other is blue-green algae, because it's not the green algae you see on scummy water. Oftentimes you can't see it. It's very hard to diagnose. We do see it occasionally, especially in northern Arizona, and it is very toxic. So botulism is caused by a bacteria. What happens is the bacteria lives in the soil, and when conditions are right, it forms spores, and then when these spores release, they produce a byproduct, which is a toxin, and the toxin inactivates nerve endings. That's what makes your wrinkles go away when you have Botox. Okay, Botox is the toxin from botulism, right? That's what makes your muscles relax, and that's what makes the wrinkles go away. But horses are very, very susceptible to it. Here's an example of a horse that's experiencing botulism toxicity, and very characteristic, one of the first things that happens is they can't retract their tongue. And they pull their tongue out, and it just hangs out there. We'll talk about a case that happened in near Kingman, Arizona. What happened is there was an outbreak of botulism toxicity in several horses. They couldn't really figure out what caused it. Ended up the USDA got involved in the investigation, as well as the FBI, because they thought it was somebody was making this toxin and poisoning these horses. Turned out that on this particular farm, ranch, a donkey burro foal had died about 1.5 miles or 2 miles from the ranch headquarters. Birds came and fed on the carcass, and they picked up the botulism toxin from the birds picked it up from the carcass, and then they flew over and defecated into the water trough that the horses were drinking out of. The birds, like buzzards and those kinds of birds, very resistant to botulism, as you can imagine, considering what they're dining on. Horses are extremely, extremely sensitive to botulism. So that's how the botulism toxin passed intact through the digestive tract of the birds and would put into the water, and the horses drink the water, and that gave them enough to get botulism. You take an average sized dog, it takes about 15,000 times more botulism toxin to kill a dog than it does to kill a horse. Anybody want to guess why that is? What were dogs eating before Alpo came along, right? Things that dead animals. So that's what made them resistant. So botulism is one of the most potent organic toxins we know of. Basically, a teaspoon, 5 mils in a lake, 20 miles long, 30 miles deep, and 100 feet deep is still enough botulism to kill people. So it's very toxic. Poisonous plants, and this is almost done here. So poisonous plants are really common in Arizona. We have a lot of poisonous plants, and both in range and in suburban areas. So we have a problem, as you pointed out, with overgrazing. That really brings the noxious weeds forth, and so we have a real problem with that. Drought, because good forage gets eaten up in the drought and the bad stuff stays behind. And new pastures, hungry animals coming into new pastures, not being used to it, and they just go after whatever they can get. Gary Thrasher, who's a veterinarian down in Hereford, Arizona, been a long-time practitioner, said if you take cattle, bring cattle into Arizona, it basically takes them 5 to 7 years to learn how to graze a ranch. Cattle learn where they can go and eat and where they can get water, but they don't learn it right away, so it takes a while. So plants that cause sudden death are nitrates, Johnson grass, arrowgrass, and some of the toxic alkaloids. These are just a quick list. There's some really good extension publications that talk about toxic plants with pictures included. So we're just going to go through this really quickly. That's Johnson grass. Pigweed, which is a nitrate accumulator. Nitrate poisoning, it can occur either from plants, fertilizer, water. Basically what happens is it causes the blood to lose the ability to carry oxygen. So animals die very, very quickly. Ruminant animals are very predisposed to developing nitrate toxicity. And this is a pigweed, which can have very high levels of nitrate in it. So basically, this toxicity we've seen several times in range conditions in Arizona. Basically, it's in ruminants. Nitrate goes to nitrite in the rumen. The nitrite gets absorbed and it gets into the bloodstream and causes the hemoglobin to lose its ability to carry oxygen. The blood becomes brown or chocolate. Animals are very stressed, and death can occur in 2 to 4 hours. And it can be toxic at as little as 1% of the forage. So, if this doesn't show up too well, but this is post-mortem blood taken from the animal post-mortem. This is normal fresh blood. This is what the blood looks like with animals that are experiencing nitrate poisoning. Yeah?
Have you seen a lot of that in this past few months?
No.
Okay.
Not that we have heard of, but sometimes you don't hear of it. So.
Well, we're on a pond farm across from the desert, and so we've seen like that pigweed and the amaranth come up this year after the
Off all the rain?
monsoons,
Yeah.
like everywhere.
Yeah, and this could potentially be a really bad year because of those late unusual rains, and it is an additive type of problem. This is one of the first cases of nitrate Dr. Bob Block and I worked up, and this was cattle out by the Silver Bell mine. The source of the nitrate was hay from the Frito-Lay plant in Casa Grande. When they wash the potatoes, it washes nitrate off the surface of the potatoes. So they fertilized the field with that, and the hay that was produced was high in nitrate and was fed to these cattle to deal with a drought condition, and ended up killing several animals. There are other plant toxins. Again, there are extension publications that can help you identify these plants and try to avoid them. Dogbane is a real serious one. Local weeds cause neural problems, obviously. And burrowweed is probably in the southeastern corner of the state, one of the more common toxins. It causes, accumulates in the animal's body, and cows will excrete it in the milk. So you'll see it with calves showing paralysis or not able to walk very well. This used to be a common problem in people who would drink milk from cows that have been grazing burrowweed, because you'd get sick from it too. So it can be a real problem. So this is a cow that's experiencing paralysis as a result of burrowweed exposure. I'm just going to jump right ahead and talk about the most common toxin we see in suburban areas, so an area around Coolidge, Casa Grande. Oleander is a very, very commonly used ornamental plant, and for most of our animals, cattle, sheep, goats, highly, highly toxic. 8 leaves of an oleander plant will kill an adult cow. And we've had several cases that we've seen of either people inadvertently throwing lawn trimmings over a fence, thinking, well, we'll help the cows out and give them something to eat. Or we had one case where a pen of roping steers, windy day in the spring, dried oleander leaves blew into the pen, and they ate the dried oleander leaves and killed several animals. So it's a highly toxic plant, and it's one that's very commonly used as an ornamental plant, but can be a real problem. World milkweed was the plant that was responsible for the livestock deaths on that little Colorado River that I showed you earlier today. Highly toxic plant. Probably one of the most toxic plants we have in the Southwest. And it's very widespread. Okay, so, real quickly. As a result of this livestock loss that occurred in Arizona in 2001, we talked quite a bit about what to do. How do people get help when they're dealing with something like this? Because as you can see from what I was talking about, the idea, it's pretty overwhelming if you have to go out and start collecting environmental samples and doing individual animal assessment and maybe even trying to do a necropsy. Where do you go to get help? Well, you could try a local extension agent, but I'm not sure Russ wants to run out and do any autopsies for you. You can talk to the diagnostic lab or the state, or you can contact the alert program. So what is the alert program? Let me just jump ahead here. Okay, alert. So the mechanism of an alert response. You have extensive death loss or animal health problems. You contact a local veterinarian, extension agent, or the state agricultural office. The alert committee would have a conference call and determine the degree of response, and the alert committee oversees the response. Basically what happens is the alert program will send a trained veterinarian along with usually an extension agent or someone else out to the site. They'll make sure that everyone's safe to start off with. They'll collect the history, collect samples, and get those samples into the diagnostic lab so we can start coming up with an answer. So the thing that we stress with our alert responders is the alert system is a process. They are being paid by the alert program, not by you, the producer. So we want them to follow a very well-defined process in terms of collecting the samples, processing those samples, and what to do with them after they've collected them. So we keep a chain of information, actually a chain of custody. So all the samples that are collected during an alert response are considered to be evidence and can be used if necessary in a criminal case. There's no cost to the producer. There's no cost for the veterinarian to come out, no cost for the diagnostics. Everything is provided through the alert program. We've had several alert responses that have been remarkable in some respects. Perhaps one of the best ones that I can think of just offhand was an example of a sheep producer that had several thousand ewes up in northern Arizona. It got to be close to the winter time, and they started providing supplemental feed that they had gotten to keep the ewes' body condition up. Sheep started dying. They brought the sheep, many of them, down to the Wilcox area. A total of 700 sheep died over the course of about a week to 10 days. And it turned out that the producer had inadvertently gotten a hold of a feed supplement that was not intended to be fed by hand. It was intended to be used in a total mixed ration. So it had a feed additive in it that was never intended to be fed just by itself. And so the sheep, each pound of the supplement had enough rumensin in it to kill 3 adult sheep. So they fed several hundred pounds of this product. But it took us a while to come up with the answer as to what was going on. That was probably one of the more notable alert responses. I got a few phone calls from the FBI about that one when we didn't quite know what was going on. It's why Arizona has 800 dead sheep all of a sudden and what's happening. But it's a very good program. It's intended for even smaller scale producers. There's not necessarily a guarantee that you'll always get a veterinarian coming out, but oftentimes we do have the ability to transport animals into the diagnostic lab. There's a trailer. So if you're experiencing some significant losses, contact the state veterinarian's office and see if you can maybe get an alert response to help you come up with an answer. Because if you're trying to do this by yourself, it can be really daunting. Yes?
Number for the state.
It's on my phone.
You mentioned the samples being used as evidence. Has there ever been a need to build a criminal case off of findings that you guys have gotten?
No. I'll just say that it has been a case that did end up in litigation that involved feed formulation. I can't say any more than that.
Is that alert available in every state?
No. It was something we invented in Arizona. We didn't have any federal government help. It was a combination of the Arizona Department of Ag, College of Agriculture, U of A, and the Arizona Cattle Growers and Farm Bureaus. We put this all together. We started off with a $250,000 grant from the legislature, and we get, right now, the state veterinarian at the beginning of every fiscal year gets $50,000 to have as a checking account to pay for alert responses. As we get towards the end of the fiscal year, that $50,000 is used to provide more continuing education, training, that sort of thing for the alert first responders. Right now, there's 17 or 18 alert responders around the state. New Mexico has a very similar program that they adopted from Arizona.